Hey everybody, thank you so much. Welcome back to Braxton News. Actually, we have a great pleasure today, and really personal pleasure of mine to be here with Dr. Scheppke, who happens to be the State EMS Medical Director. He's an emergency physician and has been an EMS Medical Director for many, many years, and is really a leader within the state in EMS. Dr. Scheppke, just wanted to say hi, and secondly, just wanted to ask you, just tell us anything that you think is going on in the state that we should kind of keep aware of, and kind of let us know what you think is coming up and what's important in your mind.
Sure. Well, thanks. I appreciate the invite and opportunity to speak. So EMS in Florida is pretty robust. We're very blessed to be in a state where we've got very forward-thinking medical directors like Dr. Gandy yourself, and from others from around the state. So there are a lot of initiatives that we're doing throughout the state in some of the major areas such as STEMI, stroke care, cardiac arrest. And we're seeing that EMS is really at the forefront now of pushing medicine to improve healthcare, and really our effects in EMS is spilling into the hospitals and making the hospital healthcare better. So for instance, with cardiac arrest, we've seen dramatic improvements in out-of-hospital cardiac arrest just by doing a number of things in the pre-hospital field that is now spilling over into the hospitals, and we're getting the hospitals to be more attuned into being resuscitation centers. In the past, we weren't real good at getting cardiac arrest victims back to life. But as the science of EMS has improved, now we're getting up to 50 or 60% of these folks getting pulses back. So we're delivering a lot of these folks who normally would not have survived. They're now surviving to reach to the hospital, and our hospital colleagues are up in their game as well. So it's very exciting to see this disease that was once so fatal, and still is fatal now, but we're seeing marked improvement now thanks to improvements in EMS. In the field of stroke care, EMS is really a big leader here as well. Because we realize that where we take people is just as important as the type of treatment they get. So what you're going to see, one of the newest things now, we just had this new stroke law passed at the state level that says you, as an EMS medical director, have to consider the capabilities of the hospital that you're transporting your stroke patients to. So this thing called large vessel obstruction stroke, that is really bad stroke, and only certain hospitals can deal with that. And when we look at what EMS has done, and EMS has really been at the forefront of the science on this in terms of if we take the patient to hospital A versus hospital B, what are the outcomes? We're finding if we take you directly to a hospital that can deal with these large vessel strokes, it actually really improves population health, improves your ability to survive from the stroke. So it's pretty exciting stuff with EMS.
Yeah, I think it's really exciting. And truthfully, as Dr. Scheppke is saying, we follow the stroke care like we did with STEMIs, and we knew that the STEMI, the best way to treat a STEMI would be with angioplasty, etc., and that's what we're doing with strokes. I kind of, when I teach my medics, I said, listen, we're dealing with the plumbing, whether it's the plumbing in the heart or in the brain. If we can treat it the same, it's great. One other thing that, because we had one of our committee meetings today in medical care committee, and one of the things that was exciting that we were looking at, tell us about something about the dispatch, how important the dispatch folks, because when you try to sort of calm down now, how can we just keep closing that time frame from us, getting to the hospital or patient care and so forth. There was some exciting discussion on dispatch.
We're fine, and I'm glad you brought that up, because dispatch has been sort of the unsung heroes in the world of pre-hospital healthcare for a long time. These are the folks that are really there when someone's having their worst day of their life. They're the ones that pick up the phone when you dial 911. And these folks, these unsung heroes, are really the first responders. And what we're finding is that they have the ability to coach people over the phone to do CPR. People who have never been trained at all, they can teach them literally right over the phone to start CPR, and that causes dramatic improvements in neurological improvement for cardiac arrest. So what we're doing around the state is really listening to our dispatchers' tapes and getting in there and encouraging our dispatchers to really start recognizing cardiac arrest really early and get those callers to start pushing hands on the chest. What we find is it can take so much effort to try to train an entire population in CPR. But you train one dispatcher how to do that over the phone, that's like training 10,000 folks. So it's really a very efficient way to bring this life-saving field and this sort of lifeline rope to the callers who have cardiac arrest in front of them to start that life-saving care before EMS arrives in that critical first 6 to 10 minute range.
Terrific, terrific. Listen, we're really honored to have Dr. Scheppke here. He's a great friend, great innovator, and a great leader in our state, and that's why Florida continues to be one of the best EMS states in the country. Thanks again, Dr. Scheppke.
Thanks very much for the invite. Appreciate it.
Thank you.